latest iteration of the COVID-19 stimulus package is making its way. Discussions are underway. You've raised a lot of questions about the $1.9 trillion size of this package and whether it's appropriate for addressing the actual economic problems. Is it targeted enough? Is one of the big questions I keep hearing. Would you walk listeners through some of those key numbers?
So the first question is, sort of how much more do we need to do? And so the way I think about it is the peak to trough decline in the spring of 2020 was 9 percentage points. So GDP declined by 9%. The CARES Act was about 9% of GDP. So for a 9% problem, we came up with a 9% solution. We then did a bunch of subsequent sort of re-ups on PPP and things that added about a percentage or two of GDP. In December, we did $900 billion, nearly $1 trillion. So that's another 4% of GDP. So we're somewhere in the vicinity of 14, 15% of GDP for a 9% problem. And now they want to add another 9%. So we're going to be well over 20% of GDP for a 9% problem. That just seems like a lot. Let's put it in those technical terms. So question number one, is this really the kind of response we want? And question number two, are all of these things really directed at the 9% problem? Well, the answer is no. If you start looking in there, there are things like raising the minimum wage to $15 an hour. That has nothing to do with getting a rapid recovery from the COVID recession. There are things like enhanced child tax credits, EITCs, that are not targeted on the COVID, but are sort of permanent tax policy that the Democrats would like to get. And the list goes on. And so the real question is, okay, let's strip out the things that are just taking advantage of a crisis to do something. What's left? There they have a composition problem, in my view. There's about $400 billion for vaccine distribution, contact tracing, testing, eradication of the virus efforts. And I don't think anyone disputes the desirability of that outcome. And I don't think that's going to be contentious at all. Simultaneously, they're asking for a lot of money, trillion, to allow schools to operate in the presence of the virus, to allow childcare to open in the presence of the virus, to extend UI so that people who can't work because of the virus can have some money, and in general, a very expensive shelter from the virus approach. Well, those two don't hang together. Either you've got a strategy that's going to be successful and get rid of the virus, or you don't. So you either don't fund the vaccine thing and fund the other one, or do the vaccine thing and expect it to work, and you don't need the other one. So it's a little hard to get this to all hang together, in my view.